All right, it's Jin Ra, and I'm the Vice Chair of Quality and Safety for the Department of Surgery and the SICU Medical Director. So growing up, I didn't know that I wanted to be a physician, but looking back, I had done things that kind of probably predicted my trajectory. So when I was in my probably less than 10 years of age, I had a little clinic from our downstairs bathroom. When my friends got injured outside and we weren't supposed to be outside, I found little techniques and ways to kind of make the wounds look like they weren't as acute, so that we could, when we walked past our parents, they would not be able to identify the scratches and the scrapes and the cuts that we endured before being and playing outside. And so they came, even when I wasn't outside, they would come knocking on my door saying, hey, can you help me? I just fell off my bike and I'm not supposed to be outside. And so we would work to find ways to bandage everybody up. So I enjoyed doing that. And I had a great supply of peroxide and iodine and bandages and creams. So I always was very well stocked in my medicine cabinet. Became a surgeon because I like working with my hands and allowing the patients to come into the hospital in acute distress and being able to make them feel better and to get back to their lives. A general surgeon is a generalist per se. They are sort of the internal medicine physician that can operate and take care of patients' surgical issues at the same time. The specialty that I belong to is trauma and acute care surgery. And what that means is I take care of trauma patients, emergency general surgery patients, and the surgical ICU patients. My role as a Vice Chair of Quality and Safety is to provide data for the department and provide guidance in how best to improve the quality of care and safety for our patients. That means looking into adapting best practices that are already out there, or creating best practices if there aren't best practices for those measures. It's quite important for the patient's outcomes as well as the quality of our institution. To become a quality institution is basically being the best and the most safe institution or hospital for a patient. The research that I do is primarily outcomes and performance improvement. And what that means is we look at what we have done before and our outcomes for our patients that we care for, and make changes to the care that we provide and follow those outcomes to see if there's any improvement. We also try to collect the data in such a way that we can eventually present our data on a local, regional, or national level. Collecting good data is important because it tells us where we are now. And if there's any areas of improvement, then we can make those determinations based on the data that we have. And if there's changes that we need to make, then we can follow that data to see if those changes made improvements or made no change. And that is how we advance the care that we provide our patients. Some of the misconceptions that patients may have undergoing surgery, depending on the situation, some may think that they're going in for a cure. Some of the surgeries that we perform as a trauma and acute care surgeon are temporizing measures, and sometimes that can be a shock for the patient, or they may not be completely understanding how severe their injuries are or their disease process. And so it is our job to make sure that we continue to explain to not only the patient but their loved ones about the situation and to be there for any questions that they may have. For patients that I'm meeting for the first time, what I want them to know about me is that I would treat them the way that I would want to be treated, and for my loved ones to be treated. And I would give them the most honest answer as to what the situation is and how we would approach it to help them.